Hi, and welcome to A View from the Bed. This is a CHI St. Vincent podcast where we talk to real patients about their healthcare perspective. We know that your healthcare journey can be scary, so that's why we want to get their view on the good, the bad, and the ugly from diagnosis to recovery. Enjoy today's episode. Hey guys, welcome to today's podcast where we are talking to Charlie about his journey with esophageal cancer. So thank you for joining us, Charlie. How are you today?
I'm doing real good right now.
Yeah.
Great. I am.
Well, we were talking a little bit off camera about both Drs. Hita and Dr. Attili.
Right.
And so I kind of want you to take me back to the beginning.
Okay.
On when did you know at the very beginning something was wrong that you needed checked out?
I think that's great. That's what I should do. Let me say first that I have had Barrett syndrome, which is, I don't know if you're familiar with that or not. Okay, you probably
Some of our readers or listeners might not be.
Okay,
so
Barrett syndrome is a precancerous condition for esophageal issues, mainly in my kid's situation because of reflux issues. Okay, and I've had it for a number of years. Was diagnosed with it a long time ago. Basically, we had been over at the lake and with my wife's brother, came back, and every time we go to Hot Springs, we'd stop by McLard's back in the day to get barbecue. And we did with them, and I couldn't swallow. I didn't know what to do. Yeah. And I couldn't eat, couldn't swallow, barely could take a sip. Well, we got back home and made an appointment with a gastro doctor. Yeah. And that's when he found it. So that was back, I want to say, probably in the late 90s, I'm thinking. Okay. So ever since then, I've had routine EGDs with the gastro doctors I've had, just to make sure everything is still good. And so far, and it always told me, this is a precancerous condition, so things could always change. But it was always good until it wasn't. Okay. And coming up to date, I guess.
Well, how did they treat it?
Just acid reflux medicine. Okay. I've been on several things over the years. Now they put me on, since I've been going to Dr. Hita, he put me on pantoprazole. Oh, yes. Is what that is. Now, it's worked really well. I haven't had any acid issues at all that I can tell. Nothing I can taste or anything. But so I saw my gastro doctor, Dr. Brown at the time. He's clinic just here on University. And I thought everything was okay. He didn't say anything, and I left. Next day, I was running errands, and he called me, which is unusual, I thought, because he doesn't usually just call me out of the blue in the middle of the day. And he said, listen, he said, I'm not going to, he's kind of funny, you got to know him. He said, I'm not going to kick you to the curb, you understand, but I want you to go see this specialist I've got. He said, something was not clear, something was different, something had changed. And I said, okay. And I started asking him what, and of course he didn't want to really talk about it, and I understand now, but he said, better to just go see Dr. Hita and let's get this checked out with him because this is his specialty and everything. I said, okay. So we got started with that, and I came over and got set up with him and went in, and he started the radio frequency ablation is what he does, and started doing that. That was in, the first time I did that was in like June or July of last year. Okay. And so we got through with it, and he wanted to come back. He said, I want you to come back next month, and we're going to do another, I'm going to work on it some more. Okay. And in the meantime, he was doing biopsies on it too. Gotcha. So that everything was good on the biopsies at that point. So I went back in, and I think that was in August of last year. And he went back in for another one. And the Barrett's area was still okay, but another small area had popped up, just wasn't there before. Okay. So he biopsied that as well as Barrett's. The spot came back carcinoma. Okay. And I'll be honest with you, I was pretty shook up. I had no idea. I just wasn't. You just don't think about things like that. You know, and I know people go through this every day. We've had to deal with it in our family too. Sure. You know, with some of our other relatives, but not this, but other cancers. Yeah. But
it's a very different feeling when it's you.
Yeah. So he went in and he took the biopsies. When it came back, and he was due. That was early part of the week.
Okay.
We were there, and so I knew that Friday was going to be his last day before we went back to New York. Well, he called me on Thursday, and he said, look, he said, I'd like to go in there and cut that out before I leave. Mm-hmm. I said, I agree. So I went back in Friday morning, and he went back in again and removed all that he could, and got all the margins clear as it turned out, and the biopsies came back clean.
Oh, good.
So they sent me for a PET scan after that.
Okay.
Up here. And so I came up and did a PET scan, and it was clear as well. He had already sent me to a cancer doctor.
Okay.
I forget what you call them.
Oncologist?
Oncologist, yes. Okay. And so he called me in, and I went and met him, and he had it on. He just said, come over here and sit with me while I'll show you what we're looking at on the screen on this test, which was interesting, you know. And so he did. He showed me where it had been, and he said, you see, it's gone right now. He said, but now, he said, understand that doesn't mean that it couldn't come back. So we're going to try to stay on top of this.
Okay.
And I said, I'm with you 100% on that. Okay. Yeah. So Dr. Hita wanted me to come back in 3 months, so that put me going back in. I believe it was late October or early November, I think, when I went back in.
Okay.
And did another scope, another EGD. He did biopsies again on both, where it was on both, and they came back clean. So they sent me back in for another PET scan. This was in January, when I went back in for the next one. And so I did a PET scan a couple weeks later, and then went to the oncologist last month to follow up with it, and everything was good still.
Oh, that's wonderful.
So I'm really happy, and I'm very appreciative of Dr. Hita. I am so glad he is here.
Yeah.
And anybody that has problems with esophageal problems, I'd recommend him in a heartbeat.
Well, and I think one of the cool things that a lot of people don't realize with specialists like Dr. Hita is he does everything through a scope, through your mouth.
That's exactly right. It's exactly right.
So what was your recovery time like when he went in and removed?
I don't remember the time. It's not very long. I mean, they do put you out. They put you under for this, and so you don't know anything that's going on,
sure,
obviously. But I wasn't out that long, and I don't remember anything about that except going in and talking to them as they were prepping everything. And as usual, like if you've ever had that done, the last thing I remember was seeing them giving me the stuff, the good stuff, as some people call it. And I was out, and they'll usually, what they did with me, they'd turn me on my side and put a mouthpiece to protect your teeth and everything. And then he does what he does with that and the scope and everything. There's no incision or anything. It's all, like you said, it's all done with the scope going down your esophageal area and everything.
Well, and did you get to go home same day?
Oh, yeah. I woke up in recovery, and they keep me in there for a short period of time. Okay. You'll have to have a driver with you. That's the only thing. You're not allowed to drive on that afterwards. So my wife always went with me on that. But I woke up, I want to say probably I'm guessing within 30 minutes after that happened.
Okay.
And, of course, they want you to wait around and see how you feel and all that stuff. And, of course, I'm dry with sinus medicine. I said, can I please have some water now? You know.
Yeah.
So they give me a little bottle of water, and I lay there and everything. And when they feel comfortable with you and check your blood pressure and everything and make sure everything is normal, they'll tell you to get dressed, and we'll go get your wife and have her pull a car around. Okay. So it's just smooth as it can be.
Now, did you have any restrictions after the surgery? Like, were you on a liquid diet for a little bit?
No, just a normal diet of not anything after midnight.
Okay.
The night before, and I take blood pressure medicine, so they allowed me to do that in the morning before I went up there.
Okay.
With just a sip of water.
Yeah,
so
just a little sip.
But other than that, that's all you have to do. It's not like doing a colonoscopy.
Yeah, yeah. A lot of prep.
This is pretty simple on this.
Yeah.
It's very easy prep, no problem whatsoever. And after you go, obviously they don't want you driving for 24 hours. Back to your normal diet.
Okay.
Just like that. It's real easy.
Yeah.
It's real easy. And fortunately for me, he helped me.
Yeah.
And I hope he can help as many people as he can.
Absolutely. Well, and I think, Charlie, you said something that is really important from when you started your journey is, you paid attention when something wasn't right and started getting it checked out right away.
Stayed on top of it.
Stay on top of it. And go to your appointments like you're supposed to, all your follow-ups.
And I did.
Take your medicine.
I'm always good about that. Yeah.
Yeah. And also take your medicine.
You got to take your medicine. You got to take your, and that pantoprazole, that's a generic version of.
It's like a stomach coater.
Yeah, it's a stomach coater, what it is. And so I take that twice a day.
Okay.
And, but why it really scared me when he told me what he'd found. We had two friends a few years ago, not together, but somewhere close together in years. I can't remember the year. One of them was even up here, but it was way before Dr. Heater was here with the same stuff.
Okay.
And both of them didn't last long.
Oh,
they passed away.
Yeah, it is.
And they were about my age. We were all about the same age, but back then they were a little bit younger than what I am now, probably in their 60s is what I'm, so.
Well, and I think too, technology has come so far, and the advancements of specialists like Dr. Hita.
Yes. They didn't have a lot of it. They didn't have any of this stuff back then.
Exactly. And it's one of those that having a physician or getting connected with a physician like Dr. Hita, it really does change.
It does.
Everything.
It does.
Your outcome, your quality of life.
It does. It really does.
Now, how often do you go see Dr. Hita?
Well, the good news on that is here we go again. He said, we're going to stretch you out to 6 months this time.
Okay.
And then we'll check you. And he said, at that point, if everything's still good, we'll see. We might even go to a year.
Okay.
And I'm thinking, well, good. That's great. But obviously the caveat on that is if you notice anything, let them know.
In between.
Yeah, in between
visits.
Whatever on that. So.
Yeah.
And I said, you can rest assured I'll do that.
Absolutely.
And but if anybody is out there that has esophageal problems, take care of it. Get a doctor on it right away because it just doesn't take long. This is a very aggressive cancer is what I found out.
Yes.
Very similar to the reading I've read up on it, similar to the deadly cancer of prostate cancer. Same type of stuff and very aggressive.
Very aggressive. It is. You're right. And, it's a lot of times too, just like you said, if you'd heard that you had chronic reflux or Barrett's or things of that nature, even if you've been told there's nothing they can do, ask about Dr. Hita. It's worth the conversation because there are so many newer things now that they can do that even if you were told years ago, make a new appointment and see what your options are because options have opened up and it's worth it.
And that's what I had always been told, that there was very little they could do in the past, and the problem with that is if they tried to resection it, esophagus is just not long enough. If you try to resection it,
you got to bring the stomach up.
You got to bring your stomach up or do something. And,
you got to do something.
It was very difficult. And the other thing I forgot to tell you about, my youngest brother and he was 5 years younger than me. He had what I think was a similar thing, but this was back in the 90s.
Okay.
And he was fairly young back then, and he passed away back in the 90s. Yeah.
Yeah.
So it doesn't take long.
It does not take long, and the great thing too is that even if you don't have Barrett's, but you've had chronic reflux, over time, like Charlie had mentioned, it can turn into some of that precancerous, wearing down of the esophagus. And Dr. Hita is going to start doing a procedure called the TIF that actually will help with chronic reflux, GERD, those types of things here in the coming weeks to even help further if you're a chronic Prilosec user or pantoprazole user, to continue to make that quality of life even better without medication. So more to come in the coming weeks from Dr. Hita about that procedure, but just know that you have options.
I'm glad to hear that. I'll certainly talk to him about that too as well. I like the sound of that TIF.
Yeah.
Okay, that sounds great.
It's a cool procedure because he actually goes in and rotates your stomach. Mm-hmm. And what it does is it helps stop the acid erosion from coming up your esophagus. And it's super cool. There's a lot more. I made it sound super easy. But there's a lot more that goes into it. But the recovery time is super quick, super easy. And
that sounds wonderful. It sounds wonderful. If I may add something, there's a couple of things. If you have acid reflux, a couple of things that'll help. If you don't have a bed that will elevate your back.
Oh, yeah.
And I don't, because for the time being, my wife likes our bed we've got. So they make a wedge. You can get wedges.
Oh, like a wedge pillow?
Yeah.
Okay.
Yeah, that's what I sleep on every night. I've got a wedge. Now I put my regular pillow on top of it too. Sure. So that your back is elevated where that will not, you're laying flat.
That's a great idea.
Especially if you're a back sleeper. And I am a back sleeper primarily. So, and they're not expensive. You can get them at some of these specialty drugstores around town.
Oh, yeah. I'm sure even Amazon.
Amazon's got them, yes.
For folks that like the delivery service and know our Amazon drivers by name.
Absolutely, because I've looked them up. They've got them on there, and they're very reasonable. I would recommend it. I've been sleeping with one of those things for, I know, probably 5 or 6 years now, at least, maybe longer than that.
That's a great idea.
Yeah. If you're laying flat, just think about the flow.
Gravity.
Yeah. Exactly.
Things don't stay where they're supposed to.
Matter of fact, her nephew, he lives in Chicago now. He's an attorney up there down my wife's. Visiting with him, his father, my wife's brother, passed away back 2 years ago, cancer.
Oh, wow.
Not this, but bone cancer is what he had. So, and he was a retired physician. Yeah, so, but his son, he lives in Chicago now, and he's a lawyer up there. And I was talking to him, and he uses one because he's afraid of it too because he has acid reflux a lot. So he started doing it too. He's got a wedge as well. So
listen,
I was proud of him.
I stack pillows.
Well, that'll do it too.
Yeah.
But
that wedge is amazing.
It's so much easier. I just got it up against the headboard and I pull my pillow up, and if I'm watching TV before I go to sleep, I can lean up there and kind of sit up.
That sounds way more comfortable than just trying to stack
pillows. It is. It's more comfortable like that.
Heck, you know what? It's helpful to have a wedge just for when you get sinus season.
It is.
When you cough and have drainage.
Yep. Because I do. I have sinus issues as well. So,
lots of use for a wedge pillow.
Yeah. They're not expensive at all. In fact, I think Walmart has them.
I'm sure they probably do.
I'm pretty sure they do. It seemed like someone told me they saw one in there.
They probably do. If not, I'm sure you can order it on their website.
Amazon,
Walmart.
I hope this has been helpful to anybody that sees this with a acid reflux problem or esophageal problem.
Yeah. Talk us through a little bit, Charlie, about what were some of the things that you did to kind of overcome the mental and emotional feelings when you heard that you had esophageal cancer? What would you recommend to somebody that?
You have to keep a good attitude and not get yourself down. You got to be positive. And that's what I tried to do mainly, because to me, I think if you're positive about anything, it's going to help you with anything that's going on with your body and vice versa. If you get negative about it, then it's not going to help at all. And calm yourself down that's what I did, just calm myself down and thought about it, talked to my wife. We had, excuse me, had a conversation about it, and we still talk about it. And, but that's the thing right there. Just keep a positive attitude is the most important thing, I think.
I love that. I think there's a lot of medical research about the power of a positive attitude, and especially when you trust the care team around you.
Absolutely.
I think that's super important. Just as important as having the right position is making sure. Oh,
absolutely. You're right.
Yeah. No, I love that. So 2 takeaways from Charlie. Positive attitude and get you a wedge pillow. I love that. And there's nothing like being positive while you're sitting up, not experiencing reflux in bed.
Oh, absolutely. Absolutely. I totally agree. Absolutely.
Well, Charlie, you have been an utter delight today. And
well, I appreciate that. That's what I try to do all the time.
Absolutely. And there are so many folks out there that struggle with reflux of all stages, which is one of the reasons why we really wanted to talk to you about your journey, is to uplift individuals, but share what you went through and what can possibly help someone else. And I always say this on every podcast: if something doesn't feel right, it probably is not right. So always, always, always talk to your medical provider about what's going on with your health, because there's no better advocate for your health than you.
That's absolutely correct.
Well, I don't know who we're going to talk to next time on the podcast, but it'll be something interesting. It'll be something you need to hear. So make sure you join us next month. And Charlie, thank you so much for being on our podcast.
You're very
today.
welcome. I've enjoyed it too.
Absolutely. Thanks, guys. Thanks for joining us for today's episode of A View from the Bed, A Patient's Perspective. We hope that you found it helpful. We hope that it helped you make your healthcare decisions. We hope that it made you feel a little more comfortable with your own journey. And we hope that you'll join us next time.